Welcome to Find Your Shape, a podcast by Lewisburg Plastic Surgery featuring Dr. Alexander Moya, the expert in body contouring after weight loss and inventor of the Corset Body Lift. Hi, my name is Brittany, and I will be your host. In each episode of this show, Dr. Moya and I will discuss the complex world of body contouring after weight loss. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision for your personal situation. You've lost the weight, now let's find your shape. Well, hello again there, Dr. Moya.
Hi, Brittany.
How are you?
I am good. How are you?
Good. So today I want to talk about pregnancy and waistline contouring. Tell me about what do patients need to know when considering those things?
I get that question asked quite a bit. So two different parts of this, I guess we could break it up into two different parts. One would be before waistline contouring, the other one would be after. Mm-hmm. Okay. So I would say when you're considering getting pregnant and you're considering waistline contouring, we usually tell patients that they should wait at least a year after childbirth. And part of that is you want to let your body to go back to its pre-pregnancy,
settle, heal.
Yeah, pre-pregnancy size, state. And at that point, one can consider waistline contouring. And when we say waistline contouring, that could be anything from a tummy tuck to a corset body lift. So that's pretty straightforward. Now, the key thing when you start talking waistline contouring in pregnancy is you really want to, for certain patients, you really want to wait till you're done having children. If that's it, in my opinion, that would be if you don't have a lot of skin. Mm-hmm. So it's a little bit different if you're talking a tummy tuck after having a child or two children, and you just have some loose skin, and you have your muscles are now separated, and you're not really somebody who's lost a lot of weight. Mm-hmm. Then you really should wait, because if you get pregnant again, you're going to kind of lose all those results.
Right.
We're talking about after weight loss changes. So if I see a patient, they're 20. And that's pretty typical. A patient might be 20, 21. They're looking for some skin removal from the waist. They're obviously in their childbearing years and they want to consider having children. I would say you don't have to wait. You want to feel normal. Mm-hmm. So it's okay to have your skin removed from your tummy. And in that case, you need to wait at least a year after the surgery before you consider being pregnant again. And why? In this case, you want to be healed from the surgery, obviously, because it's a strain on your body, and if you're being pregnant, it's another strain on your body, right? Mm-hmm. So you want to get past that part. But the main reason also is you want your scar to be as mature as possible. Obviously, your tummy is going to get bigger; it's going to stretch. Obviously, if you weren't pregnant before, most likely we don't have to tighten your muscles, so there's no issue there. If we did tighten your muscles, you can still get pregnant, and your muscles will stretch as they would normally. Mm-hmm. Some patients say, well, if you tighten muscles, am I not going to be able to get pregnant again? Will I not be able to stretch? Mm-hmm. My tummy not be able to stretch to accommodate the growth of my child? And I'll go, no, it'll stretch normal as it would normally. It's just that we fixed the gap between the muscles.
Right.
But everything will still stretch. So that addresses that question, as in, yes, you can still get pregnant even if you get your muscles tightened with whatever waistline procedure you so choose. Mm-hmm. The next question would be when we talk about scar maturation, meaning the scar healing. Mm-hmm. When a scar is healing, what does that mean? It means that when you look at a scar and it has color, red and pink, it means it's still healing. It's still turning over. The way scars heal is there's a lot of activity in the scar. It's getting your body's laying down more scar in the scar, then it's breaking it down, then it's laying down more and it breaks it down. So it's this process that goes on and on and on. And eventually the part that's breaking down will overcome the part that's laying down. And when that happens, the color starts to change and it starts to fade. And eventually that color of that scar will be colorless. There'll be no more color in it. Mm-hmm. So at that point, we say that a scar is mature. When that happens, then there's less chance of that scar stretching. Okay. Basically, a pink scar is an immature scar. That means it can be prone to stretching, just like it could be prone to getting hyperpigmented or, becoming brown if patients were to go out in the sun
Right.
and have no protection. That scar is hyperactive. So I always recommend patients, even if it's just a regular tummy tuck, and you do a tummy tuck type incision, that they should wait at least a year to let that scar settle. Very, very important if you're doing an up and down incision, meaning like a fleur-de-lis tummy tuck or a corset body lift. Because when you do an up and down incision, there's a lot more tension on it when you're stretching and becoming pregnant. So there, you definitely want to wait until you see that the scar has no color in it. And that could be upwards even 12 to 24 months.
Okay.
If you want to have the best result in regards to the fact that your scar is not going to stretch.
Okay. Tell me about some of your body contouring patients that have had children after their surgeries. What have you seen as far as their results, maintaining their results?
I would say that depending on what type of procedure they've had, and let's talk in particular Corset Body Lift, because that's the up and down scar. I mean, a lot of patients ask, well, what will happen? Well, first of all, will it be able to stretch? The answer is yes, of course. The rest of your skin stretches normally. There's a scar in the middle. The scar may not stretch, but your skin will stretch. So just answer the question about can I get pregnant and will the skin stretch? So the answer is yes there. The thing about a Corset Body Lift, when you're removing the most damaged skin, which is in the middle, when somebody's heavier, gaining weight, and the tummy stretches, it's usually in the front. You get the stretch marks. That's damaged skin. So if we remove all of that skin, which is what a Corset Body Lift does, basically I remove the skin of the whole entire abdomen from flank to flank, and I bring the skin from the sides back over to close everything, that skin is healthier. That skin hasn't been stretched out like the front. So in that case, that skin will stretch and shrink more normally. So there's a good chance those patients will not end up with loose skin
Right.
after 1 or 2 pregnancies. I've even seen somebody who had 3 pregnancies and she had very little loose skin. Now, if they did have some loose skin after the pregnancies, it's an easy little secondary procedure you can do. You can re-cinch, you could re-lift, you could re-tuck, you could do a combination of those. So with a Corset Body Lift, you can always redo a small part of the procedure if you need to take away skin.
Okay.
But most patients, we just don't see that.
Right.
So it's when it comes to a comprehensive procedure like that, that's one of the win-win parts of it.
Yeah, that's good for them. They end up maintaining that nice shape after everything.
Absolutely.
Okay, that's a lot of good information. Thank you very much.
All right, you're very welcome. Thank you.
That's a wrap on this episode of the podcast, brought to you by Lewisburg Plastic Surgery and Dr. Moya. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery or the Corset Body Lift by Dr. Moya, please visit us online at lewisburgplastic.com. We'll see you next time.